Dr. Larkin, and I'm going to be your general dentist here in San Diego. So here at this practice, we welcome anyone. If it's a first visit and, they're very nervous, I like to kind of let them take the reins on how their visit is going to go. We want to make sure they're comfortable, have any of their questions answered, and kind of start from the beginning of what brought them in today, how we can help them, and the progress that will be made throughout each of their visits. At the initial visit, we'll start with taking all of the health history information, get all the diagnostic things that we need, x-rays, medical history. We're going to take a look at a deep dive at all of the teeth and take some photos and kind of give you a plan of what we're going to be doing start to finish. Every plan is tailored to the patient. All the treatment can be done over a few visits, over many visits, but I just help prioritize where we start so we can leave the day with a game plan of what we're going to do. We're going to start off with our first visit, taking care of the most important things and kind of letting you know each step of the way where we're going to go to get to that final end phase of total health. We want to make sure we're out of pain, we're making sure we have the smile that we want, and that we're set up for our wellness visits after that to make sure we're on a repetitive schedule to stay healthy. Things that I like to make sure every patient leaves here with is a sense of confidence in their smile, a sense of health and, being out of pain, having the healthy gums and teeth that they see other people walking around with. I want them to leave knowing that they can have that when they're done with our visits, because the health of your mouth is related to the health of the rest of your body. We want to leave here knowing that we're doing everything that we can up here so that the rest of our body is at less risk for heart attack, less risk for stroke, diabetes, all of that, because ultimately we want the best health for ourselves. For the average patient coming in for your preventative visit and getting all the diagnostic information, we're going to be doing an exam. You can expect to get your gums checked, to get a cleaning done by one of our wonderful hygienists. And you're going to be doing that, if everything is nice and healthy, about twice a year. Now, if we need a little more help, sometimes we'll have to bump that up to 3 or 4 times a year. But this is how we cater things to our patients, see what they need, and kind of will guide you as far as how often these visits will need to be. So I'm here to be open and transparent. Any questions you may have, happy to help and give you the best smile possible. Thank you for being here and watching this video, and I hope to see you again.